Hi, and thank you for allowing us this opportunity to bring to you this presentation regarding diversity and cultural competence, which has been prepared for the Methodist Hospital in Houston, Texas. My name is Ariel Duran, and I am the Practice Administrator at Murdoch Pediatric Services in Cleveland, Texas. This presentation is a collaborative effort by a diversity-inclusive team comprised of current MBA candidates with focus in healthcare leadership management from West Texas A&M University. Their respective titles and affiliations are listed below. Let us continue by sharing with you this quote from ex-President Jimmy Carter, which relates very much to our presentation. We become not a melting pot, but a beautiful mosaic. Different people, different beliefs, different yearnings, different hopes, and different dreams. Let us go. Diversity and cultural competency in healthcare. The goal of this presentation is to provide greater insight on the following topics: U.S. Census expected changes in demographic trends, the need for more diversity, inclusiveness, and cultural competency in the healthcare workforce, closing the gap in healthcare disparities, and improving the quality of healthcare for all, improving interactions with a diverse patient population, and integrating a diverse population perspective. U.S. Census demographic change projections. By 2043, minority populations will become the majority in the U.S., comprising of 57% of the population, up from 37% today. Non-Hispanic whites will remain the single largest population. By 2060, however, nearly 1 in 3 Americans will be Hispanic, more than double from currently to 128.8 million. African Americans will increase to 61.8 million, representing 14.7% of the population. And Asian American will double to 34.4 million, representing 8.2%. Aging population, 65 and over, will double to 92 million. Our current healthcare system is in desperate need of diversity, inclusiveness, and cultural competency. It needs to be able to increase the racial, ethnic, gender, and generational diversity of healthcare leadership, which is essential for the provision of culturally competent, value-based care, and for this population to reflect the population they serve. They need to recruit and retain a diverse management team, which is a competitive advantage. Leadership has to be keenly tuned into seeing the world from different perspectives. Also, valuing the differences in others is going to elevate our ability to meet the expectations of our customers. Healthcare systems need to be able to provide care to patients with diverse values, beliefs, and behaviors, including the tailoring of delivery to meet patients' social, cultural, and linguistic needs. We need to be able to close the gap in healthcare disparities. This can be accomplished by leveling the landscape, by improving equality through more accessibility, timeliness, and quality outcomes. Also by creating more value, by implementing a interdisciplinary or transdisciplinary approach, developing more comprehensive strategies with a holistic perspective, and reducing barriers in care, while executing greater collaboration between primary care providers and specialists. Improving interaction with a diverse patient population. This can be accomplished through partnership building. Providers need to be able to change their autonomous and hierarchical behavior to become more of a partner in care, with more flexibility, self-awareness, empathy, and focus on treating others with respect and dignity. Also, removing providers' biases by recognizing the importance of social and cultural influences on patients, considering how these factors interact, and devising interventions that take these issues into account. Also, more research-based education and skill-building training to understand and effectively interact and communicate with multicultural patient population and colleagues. Another challenge that we're facing is how to integrate a diverse population perspective, which is important. We need to bring members of the community to the table to help guide the organization as it continues to assess and update policies and practices. Also, embedding diversity and the benefits of diversity across the multiple disciplinary departments, and segments within healthcare institutions. The model of healthcare delivery needs to be transformed into a patient-centered approach. Now that we have highlighted these topics, we are going to continue by covering them in more detail. My colleague Amy is going to take over the presentation from this point on and provide you with competence training information.